about perineal tear. There are four types of perineal tear, degrees of perineal tear. As you can see here, this is the perineum, the vaginal folds are seen here, and these are the muscles, and this inside this thing is vaginal mucosa. As you can see, this structure below this is anus. This inner circle is anus, and this is anal mucosa. This is the sphincter. This one external anal sphincter, that is EAS, and this one is internal anal sphincter. Now, it's very easy to remember the degrees of perineal tear. The first degree is the involvement of vaginal epithelium plus minus skin. So whenever there is vaginal epithelium as well as skin is involved only, not further injury, that means that is the first perineal tear, first degree perineal tear. It can heal by itself if we don't need to have too much of stitches. Okay. Now the second degree tear is vaginal skin plus muscles. Okay. When we give episiotomy, that is a second degree tear. The involving of muscles needs suturing, so we do suture of episiotomy. Okay. Now what is the third degree of suture? Third degree of perineal tear, when the perineal tear reaches to the anus. There are three particular types. The A means less than 50% involvement of the EAS, that is external anal sphincter, less than 50% involvement. This is only. The B means more than 50% involvement of the anal sphincter. C means involvement of the internal anal sphincter. Okay. And the fourth degree is whenever the involvement of anal mucosa, that makes the fourth degree perineal tear. So these were the 4 degrees of perineal tear. Now, first of all, prevention of this kind of tears. We use modified Ritgen's maneuver. When we deliver the head of the baby or a breech of the baby, what we try to support the perineum with the help of the palm of one hand and the fingers of other hand. Okay, so what does that mean? Support the perineal tissue while delivering the head of the baby. That's why preventing or minimizing the perineal tear. Sometimes you need to do is what? Episiotomy. That episiotomy also prevents further degrees of perineal tear. Management. We also know this thing. First degree and second degree can be managed in the labor room only with simple episiotomy suturing. That is available in another my video. Whenever there is a third and fourth degree of tear, we need immediate action. We need immediate repair in OT under general anesthesia. First of all, we stitch anal epithelium by using Vicryl end-to-end anastomosis. Then internal anal sphincter and the external anal sphincter repairment done with the end-to-end anastomosis and with the use of Vicryl, that are long-lasting sutures. Now, after then, the normal perineal tear is repaired just like episiotomy repair. Whenever the tear is there, the patient can have vaginal delivery in future, but still they need at least 1 year of rest, and at least minimum 6 months are needed so that the previous perineal tear can be completely healed. Thank you.